There's so-called type 1 diabetes, formerly called juvenile diabetes, that occurs in individuals whose body wages an autoimmune attack against the insulin-producing beta cells in the pancreas. And over time, as that beta cell mass is lost, there's no longer insulin produced, and these individuals have problems with managing glucose levels appropriately. On the other hand, the vast majority of diabetes is so-called type 2 diabetes, what we used to call adult onset diabetes. In them, the body does make sufficient amount of insulin, but the problem is that due to obesity and other metabolic constraints, that insulin isn't used properly. In fact, a state of insulin resistance exists. These patients often will require medications to either make the insulin that is produced even a higher level to achieve metabolic control, or perhaps use drugs that may improve the ability of insulin to work effectively at its target tissues. But over time, they will require additional drugs, and then ultimately most of them will require insulin therapy as well.
Type 2 diabetes is becoming an epidemic in the U.S. The first steps toward treating type 2 diabetes are often simple lifestyle changes. Eating a healthy diet rich in fruits, vegetables, and whole grains, and low in processed carbohydrates can make a big difference in a short period of time. Adding physical activity to your routine can help tremendously too. At least 30 minutes of exercise, 5 days a week, can help keep your blood sugar levels in check. And using a combination of aerobic exercises and strength training is key. Be careful though. Exercise lowers blood sugar. So before you hit the gym, make sure you talk to your doctor about what foods to eat before, during, and after your workouts to prevent low blood sugar. If diet and exercise don't help, several medications are available to help. Some drugs work to improve your body's response to insulin, while others help the body generate more insulin. Other medications work to slow digestion and help avoid large blood sugar spikes that come with eating. And some help the kidneys filter sugar out of the bloodstream and into the urine. In some type 2 diabetes patients who may not be making enough insulin, insulin injections may be needed. Each case of type 2 diabetes is different, and which treatment is best depends on a lot of different factors. So working with your doctor to ensure you're on the right combination of treatments is essential.
Insulin is a key hormone in the body, and I think there's a major misunderstanding. People think of insulin as a medication, but insulin is first and foremost an essential hormone for the body. It's a critical hormone in terms of helping the body utilize energy properly, store energy properly, and power all of our body systems. When we have diabetes out of control, as you know, the major problem that results is high blood sugar levels. But the interesting thing is that in that situation, what's really happening to the cells in the body is that they're starving, because in the absence of insulin action, the glucose, which is the main fuel for the cells, cannot get inside the cells to do its job. So it's like being stranded on a desert island with all the food you need in cans but no can opener, or having a full gas tank and having a closed fuel line.
Eating well with diabetes can seem complicated, but here's a simple formula to create a diabetes smart plate every time you sit down to eat. Divide, add, subtract for better blood sugar. That means dividing up the portions on your plate in a better way, adding certain healthy foods, and subtracting unhealthy choices. Divide your plate this way. Make half of it vegetables, load up on broccoli, leafy greens, zucchini, bell peppers, onions, string beans, eggplant, and the like. All are easy on your blood sugar. 1/4 of your plate can be lean protein like chicken or fish. The remaining quarter can be a high fiber starch like whole wheat pasta or sweet potatoes with the skins on. Next, add blood sugar friendly foods like beans, whole grains, and lots of fruits and vegetables. and subtract the troublemakers. That includes refined grains like white rice and white pasta, which are digested quickly and send your blood sugar on a roller coaster ride. Also, subtract fattening fried foods and red meat. I'm Dr. Miller. For more ways to eat right with diabetes, watch all our smart tips. When it comes to managing diabetes, healthy habits make a big difference. Hi, I'm Dr. Miller, and here are 4 smart habits that can help you stay on top of your diabetes. Even with the best healthcare team overseeing your care, it's up to you to take care of things every day. That includes testing your blood sugar and taking medication on schedule, as well as eating right and exercising. Which brings me to your second smart habit. Exercise helps your body manage your blood sugar. It also helps you lose weight and sleep better, which also helps make blood sugar control easier. Aim for at least 30 minutes of physical activity each day. Next, follow a diabetes-friendly diet. What you eat is as important as medication to keep your blood sugar under control. Have a high-fiber, protein-rich breakfast. Don't go too long between meals, and keep snacks handy to prevent blood sugar crashes. The stress hormone cortisol raises blood sugar and increases insulin resistance. That's why diabetes educators often include stress reduction techniques in their programs. Try stress busters like meditation, deep breathing, and yoga. I'm Dr. Miller. For more tips to manage your diabetes, check out all our smart tips.
Insulin pump therapy is a way of getting insulin for diabetes. It means that you have a device which is administering insulin under your skin continuously, 24 hours a day, 7 days a week. An insulin pump is designed to try to mimic what the body's pancreas would do naturally in giving insulin. And the amount of insulin that's put out by the pump is lower when you're not eating and goes up when you're eating. And your pancreas would naturally give more insulin when you eat. So with an insulin pump, you have the option of giving more insulin when you eat a larger meal, less insulin when you eat a smaller meal. Over time, the pumps have become much smaller, much easier to use, and much more efficient. At this point in time, the next real advance is that they are beginning to react to blood sugar readings. Many people who wear an insulin pump are also using a continuous glucose monitor. The pumps can sometimes detect the glucose level from the continuous glucose monitor, and the newest generation of pumps are designed to react in some way by either increasing or decreasing the amount of insulin in response to changes in blood sugar.
Will my baby need special treatment if I have diabetes?
A baby is more likely to have healthy blood sugars at birth when the mom's blood sugar levels are within the target range. To be on the safe side, your doctor will likely check the baby's blood sugar within the first few hours after delivery. When you're discussing your birth plan with your doctor, ask about the steps you can take to prevent your baby from having low blood sugar and what to expect while you're in the hospital.
If I have diabetes, will my baby get diabetes?
Babies of mothers who have diabetes have a higher risk of developing obesity and type 2 diabetes later in life, but this risk is lowered when the pregnant mom incorporates healthy nutrition for herself and her baby, gains an appropriate amount of weight, and aims to keep blood sugar levels in their target range.
What can I expect after I bring my baby home?
Most women with diabetes will find that their blood sugar and insulin needs return to pre-pregnancy levels a few days after delivery. Not only will you need to continue to closely monitor blood sugar levels, but also you'll need to work with your doctor to adjust medication regimen.
What are the best things that I can do to ensure that my baby gets a healthy start at life?
Since taking care of yourself is not always easy, visiting your healthcare provider, diabetes educator, or dietitian to go over your care plan a few weeks after you deliver is an important step in taking good care of your baby and yourself. Also, if you decide to, breastfeeding may help protect your baby from certain health conditions later in life, including diabetes and obesity, and it can also help you lose some of the weight you gained during your pregnancy.
When I was first diagnosed with gestational diabetes, of course, what I wanted to know was, what is it and will it affect my baby?
That's a great question. Gestational diabetes is a type of diabetes that occurs only during pregnancy, and it affects 9% of pregnant women. Women will have no history of diabetes and suddenly develop high blood sugar during pregnancy. This is caused by insulin resistance, which is a condition where the body doesn't use insulin correctly. Insulin is your hormone that controls blood sugar. Insulin resistance can happen in anyone, but in pregnant women, it's caused by hormones made by the placenta. Babies of mothers who have gestational diabetes have a higher risk of developing obesity and type 2 diabetes later in life. Your baby is more likely to have healthy blood sugars if you maintain healthy blood sugars throughout your pregnancy. To be on the safe side, your doctor will check the baby's blood sugar within a few hours after delivery. It's important to discuss your birth plan with your doctor and talk about ways to prevent the baby from having low blood sugar at birth, as well as what you can expect being in the hospital. I understand that being diagnosed with a condition while pregnant can be scary, but this risk is lowered when the pregnant mom incorporates healthy nutrition for herself and her baby, gains an appropriate amount of weight during pregnancy, and aims to keep blood sugar levels in the target range.
The best way to manage your diabetes is to work with a healthcare team. Diabetes is a complex disease, and your primary care doctor really can't do it all alone. It takes a village. In addition to your primary care doctor, you ought to consider working with a certified diabetes instructor. Right, they're called the CDE, a healthcare professional trained to help folks with diabetes, an expert in this area, knows all the insides and outsides of what trip you up, and knows all the challenges you're going to face. And the CDE can help you read a food label better, manage your frustrations, even help you build exercise into your day. They know all the hacks. Work with one. Same goes for a dietitian. They can help you pick out your foods, help you make sure you're eating meals that are planned ahead of time. You can schedule them with your dietitian. And you ought to think about seeing a podiatrist as well. A lot of diabetics have problems with their circulation. The nerves don't work so well in your feet. That means that they're a little bit numb. You stub your toe, you don't know that you hurt it, and all of a sudden you got an infection. And because the diabetes hinders the blood supply, those little cuts and sores and injuries and blisters, well, they can become a big problem pretty quickly. I've done amputations, literally cut off toes for small little things we should have gotten ahead of. If I'm talking about your feet, let's go to the other side of the body, the eye. Working with an eye doctor familiar with diabetes can help you screen for the usual things, cataracts and glaucoma, but also specific vision changes that happen with diabetes because the vessels around the retina. And of course, endocrinologists, an expert in the hormones. People with type 1 diabetes who don't make any insulin typically see an endocrinologist, but folks with type 2, when you're resistant to the insulin, you might also think about seeing one if your blood sugar is hard to control. Managing diabetes isn't easy, but it's not impossible either. And with a strong healthcare team behind you, it can get a lot more straightforward. Losing weight is critical in managing your diabetes for a lot of reasons, but you don't have to run to the gym just yet. There are a few ways that might help you lose weight if you're a diabetic. First off, monitor carbohydrates. Right? It can help control your blood sugar if you know how much sugar is entering into your body. Folks with diabetes do need carbs. You gotta have some carbs, but you don't want the bad carbs that are depleted of nutrients. You want the good carbs that have lots of nutrients and they have fiber too. The fiber slowly allows the insulin then into the bloodstream. Plus, don't get huge meals. It overwhelms the body's insulin. Instead, small meals. The less the processed food that you eat, the better off you are. The more work your body has to do to digest the food, the better it is for your blood sugar. Exercise improves the insulin's ability to regulate blood sugar. It also helps you lose weight. It's good for your heart. It's good for everything. It's linked to longevity. Do some exercise right now. Go out and walk. If you're going to do some big-time exercise that you're going to break the sweat with, get your doctor involved just to make sure you're not going to have a huge dip in your blood sugar level. That's how powerful it is. And you can track your blood sugar levels before, during, even after the workout to see how it's affecting by your physical activity. And look out for those glucose dips. And if you're having them, you can take some carbohydrate-rich snacks to get it back to normal. And if you need to, get a little cell phone with you in case you got an emergency. Remember, any physical activity is better than none, so squeeze as much as you can. Forgive yourself. It's not a big deal if you don't get as much as you're supposed to. Any little bit helps. If you can add some short, intense bursts of activity, like a mini workout, jumping jacks, 20 seconds worth in the middle of the day, that allows you to help with your metabolism as well. All things you control. Diabetes can be hard on your health and how you feel, and dealing with it every day isn't easy, but you can make it easier. First off, stick to your dietary changes. A diabetic diet doesn't necessarily mean deprivation, doesn't mean you're eating sawdust, right? It does mean eating healthy and in moderation. And you can make carb counting and portion measuring a part of your routine. It gets easier as time goes on. You'll get better at math, think of it that way. And recognize the rewards that come with the dietary vigilance. You'll have lower blood sugar. You'll also probably lose some weight. You'll look best in sleep. Your friends will be so jealous of you. But most importantly, your blood sugar, your blood pressure will be better. Now, it's important to remember that it's okay not to be perfect. Make your expectations realistic. Not everyone's going to lose weight quickly. Your sugar levels aren't always going to be perfect. It's okay. Focus on the rewards that you deserve for doing the right thing, like feeling better. And I get you can be hard on yourself and you can be hard to do this. That's all okay. But don't feel guilty, because if you feel that you brought this problem on yourself, it just puts an extra barrier there that's not real. So much of this is genetic and brought about by factors you don't control. Feelings of guilt and shame get in the way of making healthy choices. So acknowledge it's there, understand it, then move on. And if you want to get some real support, tell people in your life about your diabetes, because it'll make a big difference in your care. Folks love you, they care about you, your friends, your family. If those folks want to be in your life, they know that you got the problem and they'll help you get past it. So make a list of folks and share with them your story, but also share with them the fact that you've got diabetes in case you've got a medical emergency. They'll know what to do in case of a hypoglycemic emergency where your blood sugar has dropped too much. I always tell my friends that if they got a friend who's diabetic, take a little sugar water of any kind. Just put a little bit beneath their tongue. Not too much. You don't want them aspirating and gurgling it. Just a little bit to get a little sugar in their body in case that's the big problem. And there are other little tips that your doctor can share with you as well. So look to them to help educate you on the symptoms to look for if you're having trouble with diabetes and what to do to help you out of those crises. Figure out what to eat, what activities to take, and what medications can affect you. If you do all that stuff, you'll have the trifecta, and you don't have to do it alone. Get your team on board.